Asterisk to acquire the knowledge, skills, and attitudes required to prepare a 12-lead electrocardiogram (ECG). Asterisk to learn how to interpret a basic ECG. Calculate the rate. Determine the rhythm. Identify the cardiac axis. Identify waves and intervals, and state their normal range of values. Recognize the basic abnormal features in the ECG. Electrical system of the heart. ECG paper, grid system. Asterisk 1 big box / square equals 25 small boxes / squares. Asterisk 1 small box equals 1 millimeter, 1 big box equals 5 millimeters. Asterisk horizontal equals time, s milliseconds. Asterisk 1 millimeters equals 0.04 s of 40 equals 0.04 seconds. Asterisk 5 millimeters equals 0.2 seconds. Asterisk 5 big boxes equals 0.2 seconds times 5 equals 1 second. Vertical equals voltage millimeter millivolt. Asterisk 1 millimeters equals 0.1 millivolt. Asterisk 10 millimeters equals 1 millivolt calibration. Asterisk standard 10 millimeters high x 5 millimeters wide. Typical speed equals 25 mm per second. Asterisk half standard stair-like structure voltage. ECG is set up to record at the standard 25 mm per second. Horizontally. Asterisk 1 small box equals 0.04 seconds or 1 millimeters intervals. Asterisk 1 large box 0.20 or 5 millimeters intervals. Vertically. Asterisk 1 large box 0.5 mV. Tick marks on ECG paper rhythm. Thus each equals 0.2 seconds. Asterisk equals 0.20 sec or 5 mm. Asterisk 5 thick lines boxes equals 1 second. 10 millimeters equals 1 millivolt. Limb and chest leads. In a standard ECG, there are 10 electrodes. 4 limb electrodes, with 1 each on the left arm, left leg, and right leg. 6 precordial electrodes V1 to V6. The right leg electrode is usually used as a neutral lead. Each electrode is set up to detect any wave of positive charge coming toward it. These are collectively called the chest leads. Asterisk A, performing an ECG recording. Equipment. Asterisk ECG machine, asterisk electrode stickers. Asterisk razor to remove excessive hair, if required. Alcohol wipes to remove visible dirt / grease, if required. Asterisk A, performing an ECG recording. # introduce yourself, briefly explain the procedure, and gain verbal consent. # wash your hands or use hand sanitizer, prior to starting the procedure. # patient should be lying comfortably with their chest, wrists, and ankles exposed. # enter the relevant patient information into the ECG machine prior to commencing the procedure. # inform the patient of what you are doing as you go along, and warn that the electrode stickers may be cold. McLeod's clinical OSCEs. Summary. B. Electrocardiography interpretations. Normal sinus rhythm. To read an ECG, it's important to first understand what a normal sinus rhythm looks like. Single heartbeat on an ECG from the viewpoint of lead II. Electrocardiography Essentials Edition, the Osmosis Team. Directed anteriorly, while the second negative deflection represents left atrial depolarization that is directed posteriorly. Asterisk, are there P waves? Asterisk, regular, are they equidistant apart? Occasionally irregular? Regularly irregular? Irregularly irregular. Interpretation. Regular. Determine the rhythm. Determine PR interval. Continued. Normal PR interval. 0.1 to 0.20 seconds. Interpretation. Determine the rate. Asterisk, if the rhythm is regular, calculate the rate by dividing 300/number of. The large square between two R waves equals BPM. Asterisk, if the rhythm is irregular, the rate is determined by counting the number of R waves over 15 large squares and multiplying by 20. OR. Asterisk, counting the number of R waves over 30 large squares and multiplying by 10. This is preferable if the rate is slow or irregular. QRS axis. QRS complex. Asterisk, if the initial deflection is negative, it is termed a Q wave. Asterisk, small Q waves are often seen in leads I of VL and V4 V6 as a result of initial septal depolarization and are considered normal. Asterisk, the first positive deflection of the QRS complex is called the R wave. Asterisk, it represents depolarization of the left ventricular myocardium. Right ventricular depolarization is obscure because the left ventricular myocardial mass is much greater than that of the right ventricle. The small R wave in lead V1 represents initial septal depolarization. Asterisk, the negative deflection following the R wave is the S wave, which represents the terminal depolarization of the high lateral wall. If there is a second positive deflection, it is known as an R. Up to date. QRS complex continued. Asterisk, lowercase letters a Q, R, or S are used for relatively small amplitude waves of less than 0.5 MV. Asterisk, an entirely negative QRS complex is called a QS wave. Asterisk, the entire QRS duration normally lasts for 0.06 to 0.10 seconds, 11/2 small boxes, and is not influenced by heart rate. Asterisk, the R wave should progress in size across the precordial leads V1 V6. Normally, there is a small R wave in lead V1 with a deepest wave. The R wave amplitude should increase in size until V4 V6 due to more left ventricular forces being seen, while the S wave becomes less deep. This is termed R wave progression across the precordium. S in 5.1 plus RIN V5 or 5.6 greater than or equal to 35 millimeters. Hypertrophy. Right ventricular hypertrophy, RVH, RV1/SV11. Asterisk, the T wave represents the period of ventricular repolarization. Asterisk, since the rate of repolarization is slower than depolarization, the T wave is broad, has a slow upstroke, and rapidly returns to the isoelectric line following its peak, i.e. slow upstroke, rapid downstroke. Asterisk, the T wave is asymmetric, and the amplitude is variable. Asterisk, the T wave is usually smooth up and down. If there is any irregularity on the T wave, bump, notch, ripple, nipple, etc., a superimposed P wave should be considered. QT interval. Asterisk, the QT interval consists of the QRS complex, the ST segment, and the T wave. Thus, the QT interval is primarily a measure of ventricular repolarization, based on Bassett's formula. Asterisk, quad QTC equals QT interval divides square root of the RR interval, then a sec. Asterisk, the normal value for the QTC in men is less than or equal to 0. 4 is ecand in women is less than or equal to 0. 4.5 to 0.46 sec. Asterisk, a U wave may be seen in some leads, especially the precordial leads V2 to V4. Asterisk, the exact cause of this wave is uncertain, although it has been suggested that it represents the repolarization of the His-Purkinje system, or it may be due to late repolarization of the mid-myocardial M cells due to a longer action potential. Duration compared to the endocardium or epicardium, especially at slow heart rates. Asterisk, the amplitude of the U wave is typically less than 0.2 mV and is clearly separate from the T wave. Asterisk, it is more evident in some circumstances such as hypokalemia and bradycardia. Asterisk, the U wave may merge with the T wave when the QT interval is prolonged. A QT U wave or may become very obvious when the QT or JT interval is shortened, for example, with digoxin or hypercalcemia. A systematic approach to the interpretation of the ECG is critically important. Asterisk, QRS complex, are there pathologic Q waves, bundle branch block, or chamber hypertrophy? Asterisk, ST waves, is it isoelectric, elevated, or depressed relative to the TP segment?